Welcome to the Leap Health Workplace Podcast. Here we explore innovative, proven health and wellbeing solutions to drive your performance and productivity. Leap Health empowers individuals and organisations to prioritise their health and wellbeing as a catalyst to performance and productivity. We do this by providing workplace health and wellbeing performance workshops and also the Leap 360 one-to-one leadership coaching to drive health, wellbeing and performance, powered by the Game Changer Index Energy for Impact profiling tool. And we offer bespoke corporate programs to ignite proactivity in ownership at all levels of health and wellbeing as a catalyst to performance and productivity. Whether you're sat at your desk right now or on the move, get ready to listen, get ready to invest your time and take action straight after. I'm Anna Ready. Let's get ready to make small steps to leap health. Welcome to the podcast today, and I appreciate we haven't had one released for quite a few weeks now, but hopefully today's podcast and the next two coming up, all focusing on sleep, are going to make up for that gap in the podcast being published. So today we're privileged to be joined by Dr Eidn, who will be helping us demystify some of those misconceptions around sleep in a really relatable, practical way so that you feel empowered to put small steps in place to support your sleep. And we certainly need Dr Eidn's expertise because after a recent report in April this year, which was carried out by the Sleep Charity, it revealed that 9 in 10 people are experiencing problems with their sleep. And probably right now you're thinking, that's me as well, so keep listening. And often these issues were due to sleep poverty and workplace stress. And I can probably hear you thinking now, yeah, that's me as well. But the normalisation of this poor sleep has resulted in over 14 million people suffering in silence and undiagnosed sleep disorders. And this seems absolutely bonkers that it's costing the economy and people's well-being massive amounts, and yet often getting good sleep hygiene can be free or relatively very low cost. So hopefully Dr Eidn is going to help us today with this. He's a sleep practitioner and general medical practitioner with over 20 years of clinical experience. He's personally suffered from every kind of sleep problem that there is to have, and he's got a real life understanding of what it's like to live with poor sleep, whether it's related to stress, chronic pain, medications, or mental health. He's been through them all. And so he's uniquely placed to connect on a deeper level with people to help them through their sleep difficulties. And often that's just something that we really need from the people that we're going to see about a problem, isn't it? They understand it, they've been there, and they've walked in our shoes, which is really important. He's now deeply passionate about the science of sleep and the almost limitless benefits it can bring to our health and well-being. So I'm hoping you're listening well today because you're going to take so much away from this episode. So welcome to the podcast today, Dr Eidn.
Thanks so much. That was quite an introduction. Thank you, and thanks for having me on.
Brilliant. And was there anything I missed there in that introduction?
It was pretty comprehensive, I think. Yeah. The figures that you were quoting from the Sleep Charity research are actually very recent. It was only kind of published a couple of months ago, and some of those statistics are really staggering. 9 in 10 adults have got some kind of sleep problem, is really quite staggering. And some of the statistics that we've had previously on the impact on the economy are huge. It's thought that sleep difficulties cost the UK economy about £40 billion every year. And that's just that's just lost productivity through presenteeism and absenteeism. The healthcare costs and so forth are a different matter. So yeah, it's some quite staggering statistics, really, aren't there?
They certainly are, and that's those two phrases you use there, presenteeism and absenteeism. I always refer to these when I'm talking to clients and people because often you bump into you speak to HR leaders or leaders of companies, and they'll say, well, we're fine because we've got low absenteeism levels, but actually it's that presenteeism, isn't it? And that is where it's really hard to get your good quality data around, because how many people are going to own up to say that they're working with suboptimal health at the risk of losing, risk of it not being acceptable in the workplace? So that's where we've got a missing gap with grey area, haven't we?
It's a really difficult one. It's really difficult to measure. It's really difficult to kind of quantify, isn't it? But it is a huge part of why certain people might not be as productive as we'd hope, and sleep is a big factor there, definitely.
It certainly is. And before we move on and start to delve into all these misconceptions and learn a little bit more about sleep, I'd like to tell us a little bit more about your work, but specifically around the Sleep Project and why you set it up and what you do.
Yeah, so at the Sleep Project, we're a kind of an online sleep improvement platform, if you like, a sleep improvement initiative. And there's three of us that set it up. There's myself and Caitlin, Dr. Caitlin Shasser, who we're both NHS GPs, and there's Polly Revaliente, who's been a nurse in the NHS but has been working in the child and infant sleep stage for quite a long time now. And we kind of, sleep, the three of us have always had an interest in sleep. We've always been really fascinated by it as a subject. But we really saw during the COVID pandemic, this just kind of explosion of people with sleep difficulties. And unfortunately, the NHS over the years hasn't really catered very well for sleep problems at all. It's pretty good if you've got sleep apnea, but any other sleep problem, and you really don't have many options. And sleep apnea is important. There's no question about it. But by far and away, the most common sleep problem is insomnia, and there's little to no services on the NHS for that. It's very much kind of a postcode lottery. There's only a few centres in the UK. So there was this kind of huge unmet need. Numbers of people struggling with their sleep was growing and growing, particularly through COVID. And we noticed this kind of real lack of services available for them. And that's why we set up the Sleep Project. So at the Sleep Project, we cater for all different ages, all different types of sleep problems. And we have a series of different kind of free educational tools and things that people can access. And then we also have a more structured sleep improvement programs, which are for babies, depending on age, for children and adolescents, for adults, depending on whether they got trouble with insomnia or whether they want to kind of optimize their sleep for performance. We kind of cater to the whole spectrum, really. So that's kind of in a nutshell why we set up, and we love what we do. It's been a great journey.
Amazing. So it is like a one-stop shop, every age catered for, and I think it can impact on every age, and so many life events, isn't there, that can impact on it. But we were only saying earlier, weren't we? It's fascinating how there's never actually been a public health campaign around sleep. We've had lots of different ones out there, haven't we? But actually never had a public health campaign about something that impacts on probably every disease area and just has such a profound effect. It is a real missed opportunity.
It's really interesting, isn't it? I think that kind of public health budgets they were always small compared to the kind of the general health budgets and budgets for other things, but they've shrunk considerably over the last kind of 15 years. A lot of the kind of jobs in public health have gone, and there's a lot less funding for these sorts of things. But and that applies obviously to all kinds of health problems. But sleep is something that has played second fiddle to a lot of other kind of topics, and I think people now are pretty well versed in the fact that eating a balanced, healthy diet is really important for well-being, and that doing regular exercise is really important for well-being. But actually, the kind of advice around sleep has kind of lagged behind, and sometimes I think most people would kind of recognize that the average amount of time that they should be sleeping is about 8 hours, although there's big problems with putting a number on it anyway. But I think that's about the only thing that seems to have really filtered through into public consciousness, and there's a lot more really important information out there that isn't yet mainstream. It is getting better, there's no question. There are a number of there's been some really popular books written on it. There's some podcasts that have kind of helped to promote the topic. So it is definitely improving, but I still think there's a long way to go.
Yeah, a massive opportunity, isn't it, to just make those small changes that will have a big impact. So you mentioned podcasts then. I heard you on a recent podcast actually. And you were asked about what was a quote that you would like to share. And I just love this. So this was from Viktor Frankl. And this was, between stimulus and response, there is a space. In that space is our power to choose our response. In our responses lies our growth and our freedom. So I'd like just to delve a little bit more, how can sleep really help you in that space in terms of how you react?
Yeah, so it's a kind of often quoted one, that, and it's one that really, when I first heard it many years ago, it really kind of struck a chord with me. It's kind of really kind of resonated with me personally, because I am basically, what it's saying is just take a pause, think about your response. The more you do that, the better a person you'll become over time. And I'm somebody I have Middle Eastern blood. I am a hot, fiery, kind of shoot from the hip, reacting kind of guy. And I have, for many years, always, especially when, there's something exciting, important, or whatever going on, I struggle to kind of think rationally. I react emotionally quite a lot. And that's I think why that quote really resonated with me. But it's not just Middle Eastern genes that will cause us to react with our emotions and shoot from the hip. It's also sleep deprivation. One of the most important functions of sleep is regulating your emotions, helping to regulate your emotions, helping to control your cognitive functions, and impulse control as well. And if you put all those three things together, then it really kind of, if those things are all firing at their maximum potential, then you've got every chance of pausing in that moment and thinking about your response. But if you've not been sleeping well and your impulse control is really blunted, and your emotional regulation is really blunted, and then something happens that winds you up, the chance of you managing to kind of take that moment to pause and think about your response is much, much less. So yeah, getting good sleep is absolutely vital for that kind of, to create that space that Frankl talks about, to create that space from which you can then grow. So yeah, seeing me when I'm sleep deprived is not a pretty sight.
I think that's the same for everybody, isn't it? And I know we sometimes think that we can be sleep deprived and other people don't pick up on it. But I know I looked at some data recently from a Kinsey report, which showed that when leaders were only 45 minutes of sleep, they've got 45 minutes of sleep deprivation, those people below them, I think it was 30 or 35%, felt 30 or 35% less psychologically safe around them. Which those leaders were probably thinking, I can get away with having less sleep, I'm fine, But actually, people around them are feeling it as well. So it's not just always how you feel yourself, it is the impact it has around.
It's really interesting. There's loads of data around this. And actually, the leader themselves or whoever's sleep deprived, lots of trials have shown actually your awareness of how sleep deprived you are is actually very poor.
Yeah.
So in a lot of the trials where they kind of measure performance and then sleep deprive people, the people who are sleep deprived think that they're performing well. They think that they are performing to their maximum, but actually they're significant. Even a small amount of sleep deprivation significantly impacts your performance. It's a little bit, I guess it's a little bit akin to people who've had maybe one or two drinks thinking that they're okay to drive, when really all the research shows that they're not. So yeah, both the people below the leader who's sleep deprived are probably better at recognizing the sleep deprivation than the leader themselves. It's a funny one, really. Yeah.
So we've touched on bits there around your mental health as well, but it's just to explore it a little bit more. Exactly how does, we've touched on a few bits, but exactly how does sleep impact on the various elements of your mental health?
It's a whole, not just a whole podcast episode, but a whole podcast series in
I
itself. This one,
appreciate it's a very
yeah,
big question, is that, but yeah.
it's a huge question, but it's so important, and I think this is one of the things that isn't very well understood in the general public. I think that there are individuals, no question, who recognise that when they don't sleep well, it has a real knock-on effect on their mental health. But in general, I think this is not very well understood. Sleep and mental health is very much a two-way street. We call it a bidirectional a bidirectional relationship. A bidirectional relationship, meaning that it's a bit of a chicken and egg kind of scenario, vicious cycle kind of scenario. We know that when you are sleeping poorly, it will have all sorts of knock-on effects to your mental health. So it will make you feel more depressed. It will make you feel more anxious. You'll think less rationally. But we also know it works the other way around. So when you are presenting with depression or anxiety or any other mental health condition, it will have a knock-on effect on your sleep. And what can happen is that somebody isn't sleeping, so they end up feeling more anxious. And then when they're feeling more anxious, they sleep even worse. And then when they're sleeping even worse, they feel even more anxious, and it goes round in a vicious cycle. So, so it's something that's really, really important to be aware of. There isn't a single type of mental health disorder that isn't associated with sleep disruption. So that just kind of goes to show how inextricably linked those two things are. But I always, this is something that I talk about quite a lot, and I always kind of try to make it clear that it's not all doom and gloom. This two-way street, this bidirectional relationship, doesn't always have to work in the negative direction. It can work the other way around too. So if you are presenting to a doctor with depression and sleep difficulties, we know that actually treating the sleep difficulties will help the depression symptoms significantly, or the anxiety symptoms, or the bipolar disorder flare-up, or whatever it might be. There's no mental health condition whereby those mental health symptoms are not improved by improving the sleep. And so it's very much a two-way street in either direction, really. And that's one of the things that I want to really kind of drive home, both for the general population and for health professionals, because I think as health professionals, we're not very good at asking about sleep problems. Because we think, I think in some cases, I think it's going to open a can of worms, or that we don't have the tools to treat it properly. We just have sleeping tablets, which are not the answer. And so I think that getting people to present with sleep problems to their GP more is important. But I think also getting GPs and other health professionals to recognize and ask about sleep problems is more important, is just as important as well, because we know that treating the sleep problem alongside the depression, or alongside the anxiety or schizophrenia or whatever mental health disorder it is, will produce far better outcomes in the long term than just treating the mental health disorder itself.
Interesting. So just digging a bit deeper, why is it not just common practice to ask about the sleep as a starting point when it's a logical thing to do?
Yeah. I think there's a lot of, I think there's a lot of reasons, historical reasons behind it. So I think partly patients are a bit reticent to bring it up with a GP in the first place, or with the medical professional in the first place. And I think a big part of that is that, one is that sleep has historically been kind of underplayed. The importance of sleep has been underplayed historically. And I think that the sleeping problems therefore suffer from this kind of second-class citizen type picture is, it's not that important. It's just a sleep problem. But we know that the sleep problem has so many knock-on effects on physical health as well as mental health. So for me, it's as important, if not more important, than any other problem. So I think people are reluctant to bring it up. I think when they do bring it up, their experience has been that they get the same old kind of sleep hygiene advice from the GP, which most people know about these days, I think. And then they get offered, in some cases, a short course of sleeping tablets. Now, that doesn't fix the problem. It might make them feel a little bit better for a few days, but it doesn't fix the problem. And there are all sorts of downsides and negative consequences of taking sleeping tablets, which as medical professionals, we have to explain to patients before prescribing them. So I think these things kind of make patients not want to come forward with this information. And then I think from the healthcare professional side, it's really difficult. We have a population that is becoming older, living with more and more long-term conditions, whilst NHS funding has been squeezed over the years. To cover everything in a 10-minute appointment in a general practice is really, in my view, is just no longer possible. I don't think it's possible to do a good job in that time. And so I think a lot of clinicians are worried about opening this kind of worms and it leading to appointments overrunning by a significant amount. I think they're also worried about a lack of, there's a lack of knowledge there about what to do about them. We know we can prescribe sleeping tablets, but we also know they're not the answer, and we also know they're addictive. So, and I think that the other options are not really very well known yet, even in the healthcare community, and that's part of our mission, is to educate healthcare professionals as well as the general population. So yeah, I think there's a lot of reasons behind it, but hopefully we can start to change the conversation out there. We can start to get people bringing it up. It's the statistics are staggering when you look at them. That the average person takes about 5 or 6 years of insomnia before they actually present at their GP with it, and I think that tells its own story about how these people are suffering in silence, really.
It certainly does, because a lot can happen in 5 to 6 years, can't it? In terms of your short-term and long-term health and your emotional health consequences, it can have a big impact. I think, thank you for sharing. I think what you've really done is made us realise how important it is to be proactive in your own health. So, you've just highlighted the NHS is really, really stretched. That 10-minute window of time doesn't give anyone enough time to dig deep to understand you really as an individual and what are those small steps you can do. So you've really got to empower yourself with the information and reach out to the right specialists who can really dedicate that time to you, because an early intervention is key, isn't it? As we said, a lot can happen in 5 to 6 years.
Yeah, absolutely. When the longer insomnia goes on for, the more some of the unhelpful people with insomnia develop a lot of unhelpful thoughts in their head and thoughts and feelings that get really deeply ingrained and actually prevent them from falling asleep at night. And the longer that's been going on, the more ingrained those thoughts and feelings and behaviors become. And sometimes they can be a bit more difficult to undo. But that's not to say they can't be undone. There's really effective treatments for insomnia now, particularly one called cognitive behavioral therapy for insomnia. And we have seen people who've suffered with insomnia for 30, 40 years who are completely, basically cured, but after going through one of our CBT courses. So it's completely treatable. It's completely reversible and fixable. But yeah, you're absolutely right. Doing it in an earlier stage is going to be easier and more likely to be effective than waiting until it's ingrained for many years.
Thank you. So you've just mentioned CBT then. Some people might be listening, might be thinking, what is that? What does this entail if I try it out? Can you tell us a bit more about that, please?
Yeah, so CBT for insomnia is really not very well understood out there, either by the general population, but also really not by healthcare professionals yet at all. And the reason, I think, is because there are so few people in this country who are actually trained to deliver it. A lot of people will have heard of CBT, cognitive behavioral therapy, as a treatment for anxiety and depression, and a lot of people will have gone through a CBT program for that. But CBT for insomnia is completely different from that. It's very much its own thing. It's not. It shares very few similarities with CBT for depression and anxiety. What it really is for insomnia is it gives you, first of all, it teaches you about the process of sleep, and there's a really important sleep education component to it. But second of all, it's like you can think of it like a toolbox of tricks and techniques that people can use to help them to fall asleep at night, to train their brain to be more adaptable to sleep, to help to quieten down and get rid of those negative thoughts and behaviors around sleep that impair people from sleeping. And it gives you kind of a toolbox that you can use both for the duration of that CBT therapy, but then also you have those tools and tricks for life. You know that you can, if you have another bout of insomnia further down the line, you already have the skills there, the tools and tricks from that CBT to implement. You don't necessarily have to do all of them. You can just do the ones that suit you. And we know that around 80% of people with insomnia respond to it, which is way better than you would get for any medication. People often want a kind of a quick and easy fix, a pill to take to fix it. But in a lot of cases, it's just not the answer. And certainly that's the case with sleep. But you'll never, with any drug, you'll never get an 80% response rate. That just is unheard of. But with CBT for insomnia, 80% of people respond to it. And not only that, but the 80% who do respond, studies have shown that most of the studies follow them up for a couple of years afterwards. And even 2 years later, they were still had very little in the way of insomnia symptoms. But a more recent study followed people up 10 years later and found that they had very little insomnia that had carried over. So I think, it's as close as you can get to calling it a cure for insomnia. But the awareness just isn't out there because the NHS services aren't there for it, and there are very few people trained to deliver it in this country. So at the moment, a lot of people just haven't heard of it, or when they do come across it, they think, it's like CBT for anxiety or depression. I've had that before. I'm not interested in that. But yeah, it's a completely different kettle of fish and has just really impressive success rates. So it's definitely something worth looking into if you've been struggling with sleep for a long time.
That is fascinating, really fascinating. And I think, again, it's just another misconception, isn't it? That it's the same as all the CBT. So it's really be curious about all the different options there are around there. And yeah, I myself had 18 years in the pharmaceutical industry, and I can tell you that an 80% response rate to something is phenomenal. This is, not heard of very often, is it? So it is really compelling data. So we've kind of diversified a little bit in our conversation here, but that's all good. All good. We're going with the flow. We've spoken about the impact on your mental health, but let's now focus a little bit more on your physical health, and think as well a little about even further on that mental health around the long-term complications such as dementia, including Alzheimer's, of lack of sleep.
Yeah. So we at the Sleep Project, we don't think of sleep as one of the pillars of good health. We think of it as deeper than that even. We describe it as the foundation upon which all good health is built. Through your podcast listeners will no doubt be aware, I know you focus a lot on it, on the importance of good nutrition, on the importance of exercise, and all those things are really, really important. But they kind of go out the window if you're not sleeping well. We know from studies that people who don't sleep well are much less likely to do the exercise in the first place. and they're much more likely to eat an unhealthy diet because they struggle to control their impulses, and they have hormone imbalances which make them feel more hungry all the time. So it's kind of, for us, it's the foundation that underpins all good health. And for good reason. There really isn't a single bodily system, a single organ or system in the body that isn't impacted by sleep. So that the function isn't made worse by sleeping poorly, and that the function isn't improved by sleeping better. And so it's not surprising, knowing that, to hear that long-term sleep problems are associated with a whole host of of health problems. So things like diabetes, high blood pressure, heart attacks and strokes, dementia, mental health problems that we've discussed already. The list just goes on and on. Now, it's really important that I stress, though, that these are health problems associated with long-term sleep problems. Everybody will have some kind of sleep problem short-term. It happens to us all. A bad night or two, even a bad week or two. And that's fine. That's just perfectly normal. And in the vast majority of people, those sleep problems are self-limiting. They sort themselves out over time. But the health harms are associated with people who have either long-term difficulty in sleeping, so insomnia and some other sleep disorders, or people who shortchange their sleep in the long term. So people who don't prioritize it, people who burn the candle at both ends, who don't feel that sleep is important. And so those two groups of people, the short sleepers and people who have long-term sleep difficulties, they're the ones where there are implications for their health in the long term.
Yeah, so I hope, if there's anything there that's hit home a little bit, maybe write it down, make it visual so that it is really impactful, because sometimes it's about, thinking into the future, isn't it? For it to hit home why you need to take action now. Interesting.
Especially the people who are not prioritizing their sleep. So we kind of, the people that we see or we try to reach broadly fit into two groups. There's the can't sleeps and the won't sleep. So the can't sleeps are people who have kind of sleep disorders. They'd like to get more sleep, but they can't. And then the won't sleeps, who are not prioritizing their sleep. And they are at the biggest risk of harm. People who are not sleeping sufficiently through their own kind of decision. And interestingly, we are the only known animal who voluntarily deprives themselves of sleep. And that group is really who we're trying to reach through some of the education, really, to kind of really drill home the importance of, because they can make really, really simple, really easy changes, and they'll feel better and they'll be healthier in the long run.
Yeah. And often we focus, don't we, on, particularly if you think about the workplace, it's do more. You're thinking about people thinking about building up that wealth, but actually, take a bit of a time, check in, because while you're trying to build up that wealth, you're compromising your health, and you're not going to have your health to enjoy your wealth at the end of the day. So it's really trying to think long term about what's important to you.
So true. That's one of the real problems with modern society, is this kind of always on culture, isn't it? And there's a really good Dalai Lama quote about around that. Something like, "It never ceases to amaze me how man sacrifices his health to build his wealth, and then spends his wealth on improving his health." I might have butchered it a little bit, but it's something along those lines.
We'll put it in the show notes. We'll tap that one and put it in the show notes.
You definitely said it better than I did.
So thank you. So now, I know for years and years, we just kind of thought we went to sleep and that was it. Our body was doing nothing. Then we woke up in the morning, and probably that's why we didn't really appreciate the importance of sleep. We just thought it's a bit of a hindrance. I know the phrase used to always be around, "I'll sleep when I die." But actually, what really does happen when we go to sleep? Is it just a case of we nod off, or what are the different stages of sleep and how important are they?
So I think you're right. I think that for a lot of the time, for many years, the scientific community did think just that sleep was this kind of passive state where your brain just kind of wound down and turned off, and everything rested for a few hours before getting going again. And so for a long time, it was kind of ignored, and we're really, in the scientific community in medicine, really playing catch up with all the other kind of bodily functions and areas. There's very little that we don't know about the heart these days, but we're still learning stuff all the time about sleep. And so, yeah, I think that is one of the reasons why sleep has been a little bit behind the curve in terms of being in the public consciousness about how important it is. But hopefully that's definitely improving over the last few years, and hopefully it will continue to improve. So yeah, it couldn't be that kind of notion that sleep is this passive state where not much happens in the brain couldn't be more wrong. It's an extremely active state in the brain, in the body. We're not moving our muscles, but there's so much else going on. Lots of electrical activity in the brain, cleaning out of toxins in the brain, lots of hormone cycles that kind of peak through the night and are triggered by the circadian rhythm. So it's an incredibly complex and incredibly interesting, fascinating kind of series of events. And the way that we kind of like to describe it is that the sleep at night is a bit like the cycles of a washing machine. You need all the different stages to work in the right orders in order to produce satisfying sleep. And so just in the same way that a washing machine might have a pre-wash and then a main wash and then a spin cycle, a draining cycle and then a spin cycle and then spit out clean clothes at the end. With sleep, it's just the same. You need those stages of sleep and you need all of them. They're just as important as each other in order to get good quality restful sleep. And the way we kind of break down the cycles is so each night of sleep is broken up into individual cycles of sleep, and each cycle is around about 90 minutes, give or take. There's variation from one person to the next, but around about 90 minutes. So you'll have 4, 5, 6 sleep cycles during the night, depending on how long you're sleeping for. And each sleep cycle starts off with a period of what we call non-REM sleep and ends with a period of REM sleep. And REM stands for rapid eye movement sleep. And people often have heard of that. It's the dream sleep. It's the phase during sleep that we do most of our dreaming. And that REM is really important for some of the things we've already discussed, for mental health, emotional processing, but also learning, memory, those sorts of things. And then non-REM sleep, you can think of, this is a massive oversimplification, but you can think of it as being a bit more about the physical restoration. So it's more focused on the cleaning out of toxins from the brain and the releasing of growth hormone that helps to fix the physical tissues and repair tissues in the body. So you have these two groups of two phases of sleep. Non-REM is broken down into further subclassification. So you have non-REM 1, stage 1, which is kind of that kind of drifting off kind of phase. It's kind of the transition between being awake and sleep. Non-REM 2, which is sometimes known as light sleep, but to be honest, I prefer to call it stable sleep, since you spend about half of your night in non-REM stage 2. And I think calling it light sleep does it a disservice. It's important. You need non-REM 2. It has functions that are separate to all the other stages, and you need it. So I prefer the term stable sleep. And then non-REM stage 3, which is what a lot of people have heard of as deep sleep, or sometimes called slow wave sleep. So you'll cycle through non-REM 1, non-REM 2, non-REM 3, and then into a cycle of REM sleep. And then usually in between these cycles, everyone wakes up a little bit. You just have a micro awakening. It doesn't last very long. Most people don't remember it. And then you start off with the next cycle. So, and that just goes around and around through the night.
Yeah, so many people listening to this will have thought they just nodded off and that was it, when actually there's so much going on. And I think that's a really good point to call it the non-REM stage rather than the light sleep, because I think everyone thinks of the important bits of that is REM and the deep sleep, don't they? Whereas
They
it's
do, they
all
do.
important.
There is that, and I think sleep trackers are to blame, or to are the main reason behind that. Um, but it's all important, really. All of your sleep is important, and given that you spend about 50% of your sleep on average in non-REM stage 2, or stable sleep, as I like to call it, it's a really important stage of sleep. It's really necessary, but people kind of tend to focus, you're right, on the deep sleep, stage 3, and REM sleep.
Yeah. And in terms of, I know you said earlier on, you've got that magic number of 8 hours sleep, and that's what seems to resonate with people and stick. Is it the same for everyone? How can we work out whether we need more or we need less? Does it have to be a consistent 8 hours? What are your thoughts on napping? Tell us a
Okay.
bit more about that.
Yeah, there's a lot to unpack there. It's absolutely not the same for everybody. 8 hours is about the average amount of time for an average person. And there is no average person, really. Everybody is different. We know it's kind of like it's what we call in science a normal distribution. So 8 hours is about the average, but 7 to 9 hours is completely normal. Anything between 7 to 9 hours is about right. But some people need closer to the 9, some people need closer to the 7. There are people, there's about 90% of people will need somewhere between 7 and 9 hours. But that means about 10% of people fall outside of that bracket. And so there are some people who either need 10 hours or can get away with 6 hours. The people who need less than 6 hours are very, very few and far between. It's much, much more likely that people who are getting less than 6 hours are deliberately depriving themselves of that sleep, rather than they only need that amount of sleep. There's very few people who need less than 6 hours. Very few people who need more than 10 hours as well. So if you're somebody who finds you need more than 10 hours every night on a regular basis, we don't mean catch-up sleep, but this is your normal amount of sleep that you need, then you should see a doctor, because there are it raises the possibility of whether there's an underlying sleep disorder or some other illness that's causing that increased sleep need. So 8 hours is very much an average, and 7 to 9 hours should be used as a guide for most people. In terms of how do you know how much sleep you need yourself, then that really it's based on how you feel. How you feel. If you are getting 5 to 6 hours and you feel fine and you function normally, then it's quite possible you only need 5 to 6 hours. But like I say, those people are in the minority. The best way really of knowing is thinking about, if you were free to do whatever you want, you were on holiday on a desert island, what time would you go to bed? What time would you wake up? And if you currently only sleep 5 hours, but you think if you weren't working, if you didn't have social engagements and all those sorts of things, actually you probably would sleep for 7 or 8 hours, then you probably do need 7 or 8 hours, and you're one of those people who maybe isn't aware that they're sleep depriving themselves. They kind of feel like you can function, but maybe you're not aware of it. So how you feel and how you're functioning in the daytime, day to day, is the most important marker, really, of whether you're getting enough sleep. But there's also quite a lot of newer research that suggests that it's not just the amount of sleep that you're getting, but also the quality of the sleep and the regularity of the sleep that's really important as well. So there is some data, quite recent data actually, that suggests that regular sleep is even more important than the amount of sleep that you're getting. So trying to set that kind of regular bedtime, regular wake up time, 7 days a week, even at weekends, even on holidays, is the ideal way, because that really helps to kind of entrain or fix your circadian rhythm that will give you the kind of best health outcomes in the long term. So it's more than just the amount of sleep.
Thank you. I'm actually giggling to myself right now because obviously we had the England and Spain game last night. As we're recording, there'll be a lot of people whose body clock was a bit out of sync last night. So
yeah, and
I think look, there's exceptions to the rule, isn't there?
Absolutely. We live in the real world, and sometimes there are important things. There is a wedding that you got to go to, or England are playing in the Euros final, or whatever. None of this is meant to be prescriptive. This is about giving people the information so they are informed, and then people can make their own decisions. And you can absolutely have very healthy sleep by breaking the rules from time to time. That's fine. That's totally fine. But if you get into this habit where that becomes your norm, that's where the problems can develop in the long run. So the odd night, special occasions, stressful situations, holidays, that's all fine. It's all completely normal and it's all fine.
Thank you. And yeah, just going back to like, how do you know? And you were saying, just imagine you're on holiday and how long would you sleep for then? There's a lot to be said by just listening to your own body's intuition, isn't there? And just be like real with yourself, be really honest with yourself rather than just saying, well, I only need 5 to 6 hours. Genuinely listen to your body. Your body can tell you a lot about yourself. And like probably looking at your habits during the day, which I'm sure you will do with your clients, won't you? Are you functioning after 5 to 6 hours, but are you actually consuming loads of caffeine and alcohol to manage it as well? So
absolutely, yeah. And these are some of the things that we work on with people who are struggling to sleep. Some of these behaviors, what we call coping behaviors, that they develop to try and cope with their sleep deprivation, but actually make their sleep worse. And so, yeah, caffeine is a big one. Alcohol is a big one. A lot of people will be sleep deprived through the week and then use lie-ins at the weekend to catch up, which is kind of what we term social jet lag. So different sleep times at the weekends to what we sleep during the week, and whilst that can help a little bit, it's also the kind of it's a double-edged sword because of this change in your regularity, which we also know is harmful. So yeah, I think listening to your body is the most important one. Really, is really, really good advice. And I often get asked whether you can sleep too much. There does seem to be this misconception out there that you can sleep too much. Whether that comes from kind of old wives' tales about sleeping too much, or whether that comes from some of the survival data. So people who do sleep more than 9 or 10 hours do have a slightly higher mortality. But we think that that's not because they're sleeping more, but because they're more likely to have some sort of illness that's causing them to sleep more, be it a sleep disorder or some other physical illness that's causing them to sleep more. So it's that kind of it's an association, but it's not the cause. So my view is that you can't sleep too much. Your body will wake you up when it's had enough, and so yeah. But it's a question that we get asked quite a lot. But I think that a lot of people will think, oh no, I mustn't have that line, or I mustn't sleep that amount, and actually are shortchanging themselves.
Yeah, and that really confirms the reason why you don't just believe everything that you see on social media, because data can be manipulated, can't it? And unless you can understand the reasons why things are happening and be able to be a little bit skeptical about it, then you've really got to just either go to really good quality sources or not follow everything that you see on social media.
Yeah, there's so much misinformation out there, isn't there? But also at the same time, there's loads of really great quality education out there as well. So yeah, you're right. It's about picking the right sources.
Absolutely. And so you've mentioned there a little bit around coping mechanisms. I'd like to just delve a bit deeper into caffeine. I know lots of people think that they can have caffeine and they're still not off to sleep. I'd find it a bit difficult to believe that when people say that, because I don't think you spoke about that quality of sleep. I think that could be impaired. Give us your thoughts.
Yeah, you're quite right. So it's a tricky one, caffeine, because we all love a good cup of coffee. I love a good cup of coffee, just like the next guy. And we don't want to deprive people of the joys in life. And at the same time, coffee particularly, rather than other sources of caffeine, is associated with lots of health benefits as well. But it's important to be aware of what impact it can have on your sleep and to moderate your caffeine intake appropriately. So we're certainly at the Sleep Project, we're certainly not those kind of evangelical sleep people who say you got to cut out all caffeine completely. I just don't think A, that's realistic, or B, that it's necessary, or C, that's not actually the best thing for most people. Actually, there are really impressive health benefits in terms of reducing cardiovascular risk, heart attacks and strokes, and reducing cancer risks by taking moderate amounts of caffeine. What we suggest is that people take 2 to 3 cups of coffee a day is fine, but try not to take any more than that. And keeping it earlier in the day so that it has time to work its way out of your system before bedtime. So I would say 2 to 3 p.m. is the hard stop, but if you can keep it before midday, even better. And the reason behind that is that caffeine has a half-life of about 5 to 6 hours for most people, meaning that if you have a cup of coffee at midday, about half of that cup of coffee is still in your bloodstream at 6 p.m. And if it's still sticking with that 1 cup of coffee that you had at midday, about a quarter of it is still in your bloodstream at midnight. So you can see if you're having 2 or 3 cups of coffee in the morning, and you maybe got 2 or 3 cups of coffee in your system, say at midday, you'll still have a quarter of that in your system at midnight. So you'll still have, it's a quarter of 3. You'll still have 3 quarters, isn't it? You'll still have 3/4 of a cup of coffee in your system at midnight. So it does linger around. Now, there's variability from one person to the next, and that's where some of this comes from, that people, you can have a espresso at nighttime and still sleep all right. But we also know, to come back to what you said, is that it does affect your sleep quality. Even if you feel that you get off to sleep fine with caffeine in your system, it significantly reduces the amount of slow wave sleep that you get, of deep sleep. It can reduce it by up to 20%. So that will cause your sleep to feel less restorative. And deep sleep is one of the stages where the brain is cleansed of lots of toxins. It's really important for feeling better in yourself, but also in terms of preventing long-term harm such as dementia. So caffeine in the morning, caffeine in moderate amounts is fine. That's what I do myself. But excessive amounts or drinking it into the afternoon and evening is something that we really would warn against. Certainly if you're having difficulty getting off to sleep, but even if you don't, just be aware that it can have detrimental impacts on your sleep quality whilst you're asleep.
Thank you. Yeah, so we spoke right at the beginning about sleep. Some changes don't really have to be expensive at all. So even maybe just swapping that caffeinated drink in the afternoon to a decaf version could give you a good night's sleep, which could mean that you're a lot more productive the next day, and can have multiple benefits from just one of those small changes.
Absolutely, yeah, absolutely.
Yeah. We've explored. I'm conscious of time. We're running out of time, but I want a couple more points I want to pick up on.
I'm good for time if you are. So.
Oh, that's good then. That's good. We mentioned alcohol, and how many people say, "Oh, I need a good old nightcap." Is it really a good old nightcap, or is it false economy?
So, yeah, alcohol is a problem. A lot of people, especially in this stressful society that we live in, a lot of people will use a glass of wine or a little whiskey or a beer in the evening, not just as a nightcap, but just as a way of de-stressing, of winding down. Alcohol is a suppressant. It's a central nervous system suppressant. So it kind of turns the dial down on everything that's going on in our brain. And that's one of the reasons why quite like it because it turns the volume down on everything that's going on. But unfortunately, we know it does help people to fall asleep quicker. That part of it is true. But that's where the good news ends, really. Alcohol is one of the most potent suppressors of REM sleep that we know of. So when you fall asleep with alcohol, it will suppress your dream sleep almost completely, depending on how much you've had. And so you lose all of those vital functions of REM sleep. But it also causes really disrupted sleep. You have lots of awakenings through the night. Often people don't remember these again. They're very short awakenings. But what they do is they disrupt that normal progression from non-REM stage 1 to 2 to 3 to REM. It disrupts that. So you're always stuck in the lighter stages of sleep. And so you don't get that good quality, refreshing sleep. So overall, although it causes you to nod off a bit more quickly, which is why people like it, it causes really disrupted sleep. It suppresses your REM sleep almost completely. And so without question, it does far, far more harm than good to your sleep. But unfortunately, there's a lot of people out there who still believe that it helps them to sleep or that they can't sleep without it. And that's unfortunately one of the kind of coping strategies that people do develop if they're having sleep problems or they have mental health problems or they get stressed through the day. And unfortunately, it does do a lot more harm than good. So that's another thing that we work on a lot with people. And it's difficult.
And thank you. Yeah, and after that's habitual, isn't it? And it's trying to break those habits, which can be really, really difficult. But yeah,
very much so. And because of that initial kind of helping you to get off to sleep function that alcohol has, reducing it and stopping it can actually make it more difficult to sleep in the short term to begin with. And so people often then go back to that nightcap or go back to the evening drink. And this is why it's so important to kind of educate people that actually it's making you sleep worse. Your sleep might need to get worse before it can get better, but in the long run, it will do you a world of good, both in terms of better quality sleep and in terms of long-term health benefits.
Yeah. And we're talking about there, aren't we? Things that you do like just before, an hour, maybe 2 hours before you go to sleep. But maybe if I'm right in thinking, if we focus on the things that we do during the day and way before that, we might not need those coping mechanisms as much to send us off to sleep. So what types of things, such as like activity, getting out in the fresh air, can we do during the day that are going to have a big impact on our sleep quality?
I'm really glad you've brought this up, actually, because it's so important. So much of the sleep advice out there is focused on the nighttime, the kind of evening time and nighttime. And whilst that's important, an over focus on sleep and an over focus on nighttime can actually be detrimental. That's one of the issues in insomnia. People with long-term insomnia tend to focus too much on their sleep and think too much about it. And that in itself can impair sleep. So actually taking some of the focus off the nighttime, some of the pressure off the nighttime, and think about things you can do on the daytime is actually really helpful and can be some of the kind of the most important advice. So yeah, I think really the three things that I would put in this bracket are the things that you can do during the day that will have the biggest impact on improving your sleep quality at nighttime would be, first of all, getting up at the same time every morning. We call that anchoring your wake up time. Pick a time that gets you enough sleep in total, but you can stick to every day, including weekends. So that'll be different for everybody. It depends on when you need to be at work during the week. It depends on lots of factors, but try and pick a time and stick to it. So anchoring your wake up time is one thing that's really, really important, because what that will do is help to set your circadian rhythm. Your circadian rhythm is one of the two big kind of biological processes that goes on that drives your sleep. and your sleep quality as well. So getting up at the same time every day is the first thing. Getting natural light first thing in the morning is the second thing. So we all hear about the harms of artificial light and blue light from our screens in the evenings, which, by the way, is massively, massively overblown. One of the biggest myths and misconceptions out there. But we don't hear as much about the importance of getting a good amount of light in the daytime, and particularly first thing in the morning, getting outside, getting the sunlight, even if it's on a cloudy day, you'll get far more rich sunlight than you ever will through artificial light indoors by going outside, even on a sunny day. So doing that first thing in the morning is really, really helpful in training or fixing your circadian rhythm to really kind of get really nice, deep sleep and wake cycles. So the second one is getting some sunshine at nighttime. And the way that we kind of suggest this is anchoring it to something else that you do. So if you like a nice cup of coffee first thing in the morning, take that nice cup of coffee outside, just have it in the sun, even if it's not a lovely day, having it outside in the sun. If you don't drink coffee, but you're somebody who likes to go to the gym in the morning, try going for a run outside. Getting that kind of outside sunlight is really, really important. That's the second one. And then the third thing that you can do during the day that will really improve your sleep health is exercise itself. Now, exercise doesn't have to be it doesn't have to be high. It doesn't have to be kind of this high intensity exercise. It doesn't have to be any kind of particularly strenuous, but doing some sort of physical activity and exercise every day, and the key is the regularity in it, is really, really important in improving the amount of deep sleep that you get. So picking something that you think you'll do. We have a tendency, I think, don't we, to kind of expect a lot of ourselves. So one day we think, right, that's it, I'm gonna start training for a marathon. And what happens is we do a few sessions and overdo it. We're not ready for it. And then we think, oh, do you know what? I've had enough of that. Whereas actually setting more realistic goals, that might be going for a 10-minute walk every morning. Something that you can keep to, that will get you moving, but that you can then build on afterwards when you've got into a nice rhythm and you realize, actually 10-minute walk is A, very pleasant, and B, very manageable. I'll make it into a 20-minute walk, or I'll make it into a 10-minute jog, or whatever, is really important. So those three, I think. So getting up at the same time every morning, getting some sunlight during the day, but particularly first thing if you can, and then doing some exercise at any time of day. It doesn't matter what time of day you do the exercise, as long as you do it. They're the three most important things for improving your sleep at nighttime.
Thank you. And those are not complicated, dead simple and really actionable. So I hope anyone listening jots those 3 actions down. And if you're thinking, well, do you know what? Too busy, I'm working, I can't get out during the day. We this morning were chatting before the podcast. We've got a video meeting booked this morning to have a chat before the podcast, changed it to a phone call, woken up outside, automatically getting a bit of movement, bit of fresh air, bit of sunlight. And actually both northerners, so don't get that much sunlight, so I make the most of it.
we got to make the most of it when we do, don't we?
Definitely. So I'm conscious again of time. You have a special interest in insomnia, don't you, and are keen to help people with insomnia. We touched on it earlier on. Is there anything else that you think we've not added to that topic of insomnia that we need to add to it?
I think the main thing that to stress really is that a lot of people suffer in silence with insomnia because they think there isn't anything that can be done to help it, and they might not have been to the GP with it, or they might have been offered a short course of sleeping tablets, which doesn't fix the problem. And actually, it's just to say that there is this incredibly effective treatment out there, cognitive behavioral therapy for insomnia, that works for 80% of people. It's something that NHS coverage is quite patchy about. So it depends where you live in the country. Ask your GP. But it's something that we also offer at the Sleep Project, and we offer it in online form, we offer it in one-to-one form, and the feedback that we get the most frequently from people who've gone through CBT-I is that it has changed their life, because people live with these sleep problems for years, decades. We've had people who've lived with it for 30 years who go through a cycle of CBT and are better. And when you look at the studies and things done out there, depending on which one you look at, it can be somewhere between 5 and 10 years of suffering before somebody actually plucks up the courage to tell a health professional about their insomnia. So the message is, don't suffer in silence. There are treatments that are really effective. Sleeping tablets are not the answer. There are actually, interestingly, some newer drugs that are on the way that are a bit more targeted, work in different ways to the sleeping tablets that we have available at the moment, which are very much a blunt tool. So there's lots of research going on in this area, but there is help out there. There is something that you can do about it, and even if it's been ingrained for years or decades.
Thank you. And what are your thoughts around supplements then? Just adding on to those options available. What are your thoughts around supplements? I know they're not always as regulated as much as maybe pharmaceuticals, but I know they do have a place often.
Yeah, I think that they're not the answer to sleeping problems. So some people feel that they help. And if you feel so just to clarify this, the type of supplements we might be talking about are things like magnesium, valerian root, tart cherry, lavender, chamomile, those sorts of herbal type things. They are more or less all of them have some evidence to support their use, but really the evidence isn't very robust. There's not loads and loads of trials with huge numbers that kind of prove they work. And the benefits that they have, the trials that exist have shown as small benefits. You know, it might improve sleep by 5 or 10 minutes, which might be helpful to some, but it really isn't going to solve somebody's long-standing insomnia. So I generally don't recommend them to people, but my stance on them would be, if you are taking them already or you want to try them and you can afford to spend your money on them, fine, try them, no problem. If you feel that they're helping you, there isn't any harm in continuing with them. But the evidence for me to recommend them to people isn't strong enough.
Thank you. So for you as an individual then, you know, we've spoken about everybody else, but for you as an individual now, what will be your non-negotiables in terms of your sleep hygiene?
What do I do myself, or what do I? Yeah, okay.
Yeah. So what is a non-negotiable that you've got to do for your sleep hygiene?
Okay, so I do very much practice what I preach. So I have a set bedtime. So I'm actually somebody who needs on the longer end of the amount of sleep. So I need at least 9 hours to feel okay. So I set myself the same sleep time. So I'm in bed at 10 p.m. every night. And I don't get up any earlier than 7. And sometimes I steal an extra half an hour or hour in bed. But I try to get up. When we say, by the way, when we say sticking to the same bedtime and wake up time, you can have a little bit of wiggle room, right? Half an hour here and there doesn't make a difference. Half an hour is fine. But stretching it to an hour or two, you know, people who end up going to bed 2 hours later at weekends and waking up 2 hours later on the Saturday, those are the sorts of things that really kind of send your internal circadian rhythm into a confused loop. So yeah, my bedtimes and wake up times are fixed. The environment's really important that you sleep in. So making sure that your environment is cool, somewhere between 16 to 18 degrees is about ideal. making sure that it's dark. And even though I've got pretty dark bedroom, I still wear an eye mask every night, because that does help you to get more deep sleep, and it helps with lots of the metabolic processes. So, for example, your blood pressure will be lower the darker it is, and your blood sugar the same as well. So it helps with the metabolism. And a quiet bedroom is really important as well. And again, even though I don't have a noisy house, I still wear earplugs every night, and those things kind of help me to sleep a bit better. I cut out caffeine after midday, so I'll have 2 or 3 cups of coffee in the morning, and cut that out at midday. And in general, so these are all guidelines rather than rules, right? So in general, I drink very little these days, and I try not to drink near bedtime. Last night, obviously, was an exception because England were playing Spain in the finals of the Euros. So I had a few drinks in the evening. We watched it with friends. Didn't get the result that we wanted, but I think Spain were deserved winners. And so, yeah, I'm not feeling my best today because I had 2 or 3 beers last night with the game, but generally I try to cut that out as much as I can. So yeah, those are the ones that I kind of stick to and practice what I preach with those, definitely.
Brilliant. So all very, simple little steps again that you can apply, and anyone can apply those. So thank you for sharing that.
I think that eye mask and earplugs are, for me, a no-brainer. I think everyone could benefit from them, and everyone that I've suggested it to, friends, clients, families, everyone, has been really surprised by how much of a difference it's made. And they've near enough all said to me, I don't know why I didn't do this sooner, and I'm never letting go of my eye mask and earplugs again. So I take them everywhere I go. Wherever I go away, I'll always take them with me. Yeah, I think they're a no-brainer for me.
Yeah.
And you don't have to spend much. You can get them really cheaply on Amazon for a few quid. So,
and get something that is that you can take away with you as well, can't they? Because that's when it's hard, when our habits are broken. So something that can, be a consistent habit.
Yeah. Sometimes people find it difficult to kind of motivate themselves to do things. So, the kind of getting outside in the sunshine might be difficult for some people in the morning. And some people just want, that's why we love gadgets, isn't it? As a species, we love stuff. So for the people who love stuff, get yourself an eye mask and earplugs. Not the most exciting stuff in the world, but still stuff.
Really good tips, top tips. Thank you very much for that. Thank you. So we've had a brilliant discussion, and thank you so much for your knowledge, expertise, and practical steps there that you've shared. If people are interested and want to find out more, where can they get in touch with you, or where can they find out more about your work?
So they can, everything that we do is on our website, which is www.thesleepproject.life. Or you can find us on Instagram, which is Instagram. Our handle on Instagram is _sleep_project. And we also have a YouTube channel, which has slightly longer form content. And our YouTube handle is at _sleep_project. On YouTube, we have also kind of tools for helping people to get to sleep better. So breath work that they can follow along to kind of help them relax in the evening, mindfulness meditation type videos. We've got 12-hour long videos of pink noise and white noise that people can use to either to block out external sounds or help babies to sleep. So we've got all sorts of different tools on there that people can use as well. So YouTube, Instagram, our website, and then for companies, we're also on LinkedIn if companies want to contact us, because we also go out to companies and do webinars, workshops, assessment of their sleep health, and that sort of thing.
Amazing, thank you. Sounds like some wonderful resources there. So I'd really encourage you to research them and have a look, check them out for yourself. So just leaves me to say a big thank you again, Dr. Eidn, for your time, and thank you for being part of the podcast.
Oh, thanks so much for having me, Anya. I'm delighted, and it's been a lot of fun. Thank you.
Thank you. So before you stop listening, I want you to pause. What did you take away from the podcast today? What small steps will you start? And what did you hear that you know could help someone else to make small steps to link their health, well-being, productivity and performance? Please do share this episode and please subscribe to the podcast. And remember that Leap Health are here to provide workplace, health, well-being and performance workshops, one-to-one coaching and bespoke corporate solutions to help the world make small steps to leap health, well-being, productivity and performance. Please do get in touch. It's Anna at leaphealth.co.uk. Have a great day.